8 o'clock in the morning. Before too much longer, I'm sure we'll have an opportunity to return to the firestorm of criticism from among K57 listeners this morning about 58 or so letters of support from public officials and airport contractors, tenants, and supervisors who are vouching for Santos's character and remorse for his crime, the tax dodger case here. And it looks like we're getting close to the sentencing phases. And I tell you what, there are a lot of people that are expressing a lot of disappointment and in fact, in some cases, anger over public officials making these towards in this case. I think it sends a bad message. Makes it look like we're going soft on people who've admitted to not paying their taxes. 7:39. More on that before too much longer. But I wanted to make sure that we had an opportunity to talk about this because it has been a matter of public discussion over the last several days. Last week, a conversation among the mayors about wanting to have an option to make sure that it is spelled out very clearly in any arrangements that they make for their health insurance, their employees' and retirees' health insurances, that they have an opportunity to participate with the medical care available at Guam Regional Medical City. And we talked about that. It came up yesterday at the Good News, and I'll bring Margaret Bengzon in, the CEO of the outfit, in with me now to congratulate her on the opening of your emergency room. Good morning, Margaret.
Hi, good morning, Ray.
It's always nice to have you on the radio, and nice to welcome you back to what is now, I think, your second home, Guam.
Thank you. Yes, it is. It's becoming that, certainly.
Well, that's good news. And again, the good news is we saw the first patient yesterday at the ER. Not necessarily good news for the patient, who had to go to the emergency room, but nice to know that there was someplace literally around the corner that could see to his or her needs.
Yes, absolutely. We saw a couple of patients over the course of the day, and we attended to them, and I think they're happy with their service, and we look forward to continue to serving the patients of Guam for going forward.
There are questions about what insurance companies that you are talking to and who you're writing paper with these days. And there's at least one answer to that question this morning, and that is the arrangements now that have been inked between GRMC, Guam Regional Medical City, and Calvo SelectCare.
That's right. That's right. Well, it was certainly a while in coming. But certainly in my mind, and I'd like to believe in theirs as well, this is something that needed to happen, that had to happen. And so it was always a question of when rather than if, and the when is now, I guess. And we're happy that that's over, and we can really partner together in serving the needs of the healthcare needs of Guam. Well,
let's talk about different kinds of partnerships, and Frank Campillo from Calvo SelectCare on the line right now, and he's asked to conference in this telephone call. Frank Campillo, no stranger to working with Margaret and the medical city. You and I had put together some arrangements many years ago, so it's not as though you are strangers with that company, right, Frank?
Well, yeah. Good morning, Ray, and good morning, Margaret.
Hi, Frank.
And thank you for conferencing me with Margaret. Yeah, we finally, after a significant number of weeks and having Margaret working with us and their entire team, we've been able to come to a conclusion of something that we believe may be good for our members. We have our understandings, and now we need to work very hard to make sure that we bring the logistics of delivering the care that our members are looking for, and to make sure that all of our groups are able to have access. We evidently start with the government of Guam, and little by little groups will be coming in, and evidently this is something that we just finished yesterday, and we need to convey to our groups starting today. A lot of activity will occur, and we agree between Margaret's team and our team that we are going to work very hard to ensure that the logistics are properly set. The devils are in the details, and we want to make sure that the details are correct, so that way we don't disappoint our members and their patients. Yeah.
So SelectCare patients now, SelectCare customers now, if they need service, not just in the emergency room, but if they find that their doctor prefers for them to stay over at Guam Regional Medical City, arrangements will be made for their care to be provided at that facility.
And
that's right. As Frank mentions, there are a million logistical details every time you set up a new partnership like this, in the area of healthcare certainly, and we're working through those, and we're hoping for as much of that to be as transparent to the patient as possible. But as you can imagine, there will be hiccups, and there will be little bit of inconvenience. But I think that, you know, compared to the benefit of being able to access, you know, world-class specialty care at a hospital at home, I think we can work through these little inconveniences.
Frank, have you heard from any of your SelectCare customers now about maybe taking some of the care that they were lined up for in other places, Philippines, Hawaii, California, and saying, okay, can I do this here? Have you talked to any of those patients yet? I know that the agreement is still fairly new. I mean, less than 24 hours old, obviously, but I think that there were people that may have already been telegraphing their desire to have the services at GRMC. Is that the case?
Actually, if I can...
I need you to speak up. I need you to be just as loud as Margaret.
Our agreements are only about 9 hours all. I mean, we spent a lot of time with Margaret till late in the evening yesterday trying to finalize this. But one of the things that we do evidently, we need to now convey the information to our members to make sure that the processes are in place. Again, like I told you, the devil is in the details, and one of the things that we agree between the two teams is to make sure that our utilization staff, our claims personnel, meet with their billing personnel and with their utilization staff. There are areas that we agree to. For instance, there are standard of cares nationally accepted based on evidence-based medicine that both companies have accepted that we're going to follow. So those are the type of things that we agree we're going to work on. So the important thing is that we need to make it good for the patient, good for our member, and both companies are working very hard at that.
Well, you're one of the big players in town. So as I said, I kind of want to go back to sitting at the member side of the table. If they were already lined up to have some services provided elsewhere, is there something that they can do, should do today to see if they can have those appointments moved out of the Philippines or Hawaii or California so that they can see one of the doctors here at GRMC? I mean, make a phone call to you, call the office, call the doctor. What do we do?
We are going to, thank you for asking that question. One of the things that we're going to do today will be to send, of course, a informational package to our accounts and to try to reach as many members as possible to make sure the logistics are put in place. We actually continue, as I told you yesterday, we continue to improve our delivery systems. You know, and not only we brought in our brand new local hospital, but just as of yesterday, we have also 5 brand new facilities in Southern California. And all these things are things that we convey to our members. And yes, the logistics and the information as to how to access GRMC and the protocols, those are things that we're going to be in the next few days sending to our members to make sure that we have a smooth transition on everything. All
right, but SelectCare members today, if they decided that they wanted to go see a doctor, could go to the clinic the GRMC has set up, or go directly to the hospital and see somebody there. I mean, that's all going to be covered. It's not like we have to wait for a grace period. It's effective right now. The benefits at GRMC with their doctors, with their systems of care, are available for SelectCare members.
That is correct.
Okay, that's where I wanted to start, and that I think was where we're going to end up with you. Congratulations, Frank. I know that you're a tough negotiator.
You got to congratulate Margaret, her team, the investments they have made in the community. I know that between us we had a grueling, I will call it. It was not a 15 rounds event. It was more like a 20-round event. But I think at the end, we both accepted the fact that we need to come together and put something that could work for the community quite well. So thank you, Margaret, and thank you, GRMC.
Thank you, Mike.
That is Frank Ampilio, as pleasantly as he can say it, saying that you're a tough negotiator.
Well, he's not a puppy himself, I have to tell you. Well, as I'm sure you know,
there are other players in the game here that still need to start writing paper with GRMC, and I think much of that may come from their members, from their membership, that says that they would like to have access and in-network access to GRMC down the road. Now, we did talk a little bit with Dr. Mike yesterday about another one of the big players in town, and that is Take Care. I'm not trying to twist any arms around here, but apparently they're waiting out CMS certification. Is that right?
That's what they say. Although I don't want to be a rabble rouser, but I question that. For example, their commercial book, for example, their non-federal accounts. There's not a requirement for CMS certification for their providers there, and I don't see a reason why we can't sit down, talk about covering at least those persons pending CMS certification.
All right. Well, and I think for many of our listeners, just to know that if they had some kind of emergency and GRMC is the nearest source of care, regardless of which insurance company you're with, regardless of what card you have in your wallet or purse, don't worry about it. Go and seek care.
That's true. There are federal regulations, and there are island regulations, and there's also our commitment to the island of Guam to provide care that's life-saving, that's limb-saving, that's sight-saving, and that improve quality of life on the whole. So all of that coming together really boils down to quality care for Guam at home, and that's what we're about.
Going through the list of milestones, and I'm not in the hospital business, so I imagine my list is different than yours. I mean, the construction phase done, grand opening has been done, the emergency room is open. You've got a contract with the major player on Guam, and working through some contracts with the other players. But what's the next milestone, I suppose, that people can look forward to in the development phase of GRMC?
Right. Well, we're increasing in our specialty services. As you know, we already set up a specialty clinic, so there's cardiology there's urology, there's ENT, ophthalmology is coming up soon in partnership with Island Eye. We talked about from the very beginning 3 centers of excellence, and that would be cardiology, neurology, and cancer. And so we're beginning to roll those out in a real way. Our oncologist has been here for a while. He's been doing chemotherapy. Our radiation oncologist just arrived, and he's working to commissioning a radiation therapy equipment that's really top of the line. And so that's going to be rolling out by the end of this month, beginning of October. Our cardiologist, Marian Holland, has been here for a while, and she's been taking care of patients for a while. 2 weeks ago, our interventional cardiologist came in, Dr. Shaker, and he's getting set up to begin to do interventional cardiology services. And in the middle of October, a physician who Guam is very familiar with, Noel Concepcion, who is a cardiothoracic surgeon, is moving back to Guam precisely because through the Guam Regional Medical City, he now has a platform to deliver service. So we will have a full STEMI PCI program by likely the end of November. He can begin doing procedures around that time. And so the last thing is neurosurgery and neurology. So our neurologist has been here, Justin Hale, for a while, doing sleep studies and doing neurology medical studies. Last week, our neurosurgeon came in, David Weingarten, excellently trained, very excited to get to start to work. Also setting up PSORs to begin delivering services. So these are things that Guam can begin to look forward to. Prospectively, as we begin to roll out these services over the next few months.
You've rattled off quite a number of things, but a couple of words that stuck out in my head: sleep therapy with the neurologist, as you pointed out, and I actually know people that have got sleep issues here. Is that going to be another center at GRMC? Will we be able to see somebody there or in another clinic?
Yes, Justin Hale is available. That's his specialization. We don't have a sleep center yet, but he's able to do some sleep studies even before the sleep center is set up. So absolutely, if there's need to do that, you should seek consultation with him.
I was looking at Facebook the other day, and a very good friend of mine has recently graduated a daughter out of nurse school. Are you guys still hiring? Should I send her to see Charlotte?
Yes, definitely. We're always looking for good people. There's a dearth really of quality healthcare people, and the more we bring in, if we're able to bring them home, all the better. Absolutely. Yeah.
So if you know somebody that's getting ready to get graduated, even in places like pharmacy, I mean, generally anywhere that you've got a scrub, there is an opening somewhere on Guam for, and the big player is going to be GRMC. One last thought, almost unrelated to medicine, is I know that you've got a rather large facility up there, and I know that the guys over at the Guam Power Authority were excited about the opening of GRMC because they'd have a new big customer. Did JB call you yet? Has Mr. Beneventi called on you to see if you can jump off the grid and run on your generator for a while to help keep the lights in Dedito on?
We have a central utility plant, although currently it's just provisioned for backup power.
Mm-hmm.
We are looking to be able to partner with another group to take that to the next level, which is really be able to generate our own power and maybe even sell some power back to the grid.
Well, it'd be nice one of these days.
That's prospectively going forward.
You work on the hospital stuff, and we'll let somebody take care of the electricity. Margaret, again, congratulations. It's always nice to see these milestones as they occur. And if you are a member of an insurance company, and we haven't mentioned your insurance company's name yet, call your service rep over at the insurance company and ask where they are in negotiations. Before
you hang up, I just want to say that there's obviously a lot of excitement about SelectCare because they're the biggest. But Netcare signed up first, and I really want to pay tribute to them and for that.
Very good. Thanks very much for reminding me.
All right.
All right, I'll talk to you soon. I hope I see you again soon. Margaret Bengzon with Guam Regional Medical City this morning. Sorry, I didn't get to the question on the gastroenterologist. Kevin is listening. Kevin listens when we talk GRMC. Kevin Kerrigan listens, and so Kevin, let me ask you this question on the air, and you can get back to me in the email. When is the gastroenterologist going to be coming in to GRMC?